Hi everyone, once again welcome to my Oet channel. Today we will have one Oet role play discussion. This scenario is happening in GP's clinic, and a 6-year-old boy has been diagnosed with atopic eczema, and the doctor has advised corticosteroid for a speedy recovery. But you can see that the parent is pharmacophobia. So parent is so much afraid of this medications for baby and is extremely worried about the administration of oral medication. So in this scenario, more or less we are going to convince the parent to give oral medication to his son. So here, this is a second degree talk. You are talking to parent, not to the patient, and this is they have given that this is 6-year-old boy. So these everything you have to underline and you have to keep it in your mind. We can go to the first task. Inform the parent about the condition. That is, it is ectopic eczema. It is common form of eczema which causes the skin to become itchy, dry and cracked. Common in children, and effective administration is oral medication. So nothing but we are going to explain the condition and regarding the medication also. So in this task we can come to know that still we didn't start the conversation. So we can start just like a common scenario. We can start like, good morning, get back the greeting, then you can continue. I am Rashmi Rajan, one of the registered nurses working in this GP's clinic. Then, how may I address you and how can I help you today? Then parent is telling that, good morning sister, my name is Johnson, and I came here for my 6-year-old son. We already had a conversation with the GP and he diagnosed his condition. So for getting some more information, actually came to you. Then we can ask parent, baby's name to parent. We can tell that before proceeding further, may I know your baby's name? Then he's telling that his name is Tom. Then we can tell, okay, from my case note, I can see that your baby got diagnosed with atopic eczema, isn't it? Then parent is telling, yes, of course. Okay, I'm happy to explain you regarding the condition and further management. Actually, it is atopic eczema, means it's a common form of eczema. That is some skin condition which causes the skin to become itchy, dry and cracked. But no need to worry, these are common in children in this age group. And as your baby's GP has explained or prescribed some medication, isn't it, that oral medications are very much important for the relief of symptoms. So are you getting my point, Mr. Johnson? Then patient's parent is telling that, yes sister, I got your point, but I have some concern about this management. You can tell that, oh no problem, you can ask me whatever your concern, I am here to help you. Then parent is telling that I'm not supportive for this oral medication. Really, I'm afraid that maybe in this age group he could not tolerate this medication. I'm afraid of the side effects, everything. Then the next task is explain the importance of complying with the medication for speedy recovery. We can tell that as a parent, I can truly understand your concern, Mr. Johnson, but no need to worry. I would like to explain you the importance of complying with the medication for your baby's speedy recovery. Are you getting my point, or is it clear for you? Then the next task is explain that the medications are not harmful, which will lower the inflammation, ease the swelling, itchiness, redness and allergic reaction. Then we can continue with the same conversation. Moreover, I would like to tell you the importance of medication which is not harmful for your baby. Instead, which will lower the inflammation, your baby's swelling, itchiness, redness and all allergic reactions. So without medication, if you follow all other measures, means it will be useless. How does that sound? Then the parent concern is that explain necessary to take oral medication along with topical medication. So he's telling about the importance of topical medication. So maybe he will tell to you, sister, I can understand the importance, but already there is topical medication like cream. So with that cream, is it okay to cure, whether it is okay to continue with the creams only without any oral medication? We can tell that. I can sense your feeling, Mr. Johnson, but the oral medication along with the topical medication will give you a quicker result. Your baby will get well very soon. Then, inform if untreated, it will spread quickly and lead to further complications. So maybe there is one question from parent. We can ask, do you have any concern? Any more concern? Then parent maybe ask you regarding the continuation of treatment with only topical. Then maybe he's telling that, sister, I have an idea. I will continue with this topical medication for my baby, and later on I will see if there is any, if there is no improvement, I can come back along with my baby. Is it okay? We can tell that, Mr. Johnson, actually I'm really sorry to tell you that if your baby's problem untreated, it will spread quickly and it will lead to further complications such as blister formation and infection. So you are telling some complication means you have to add, I am really sorry to inform you. But after this complication, you have to tell that, but no need to worry, with this management, your problem will resolve, like that. So here we can tell that, really I am sorry to tell you, Mr. Johnson, if your baby's problem will keep untreated, it will spread quickly and lead to further complications such as blister formation and infection. But no need to worry. If you provide this oral medication along with this cream, of course your baby will get well soon. I am assuring with that. Then the next task is convince the parent by offering additional support. Then we can tell that, example, if still parent is arguing with the same point, means we can tell that, well, Mr. Johnson, so for your information, I can provide you some additional support also. We can give 1 dose of oral medication along with the topical administration of creams to your baby, and we can monitor whether your child is coping with this medication or whether he is developing any side effects or anything. You can just wait here for 15 to 20 minutes after the oral administration. How does that sound? Then parent is telling that, okay sister, we can go for that because you are telling there is no other solution for that, so we can have it. Then we can tell that, really thank you, Mr. Johnson, for accepting my advices. So if you don't have, do you have any more concern? If there is no more concern, may I proceed with the oral administration of your baby's corticosteroid? Then parent is telling that, okay, you can. Then we can wind up the conversation. So this is nothing but parent has pharmacophobia. Parent is not willing to give this medication to his son, even it is home medication, but we are convincing the parent to continue with the oral medication, and we are giving reassurance, we are giving support. So the explanations, without this medication, the recovery will be very delayed. So like that, we have to explain more and we have to convince the parent, and at the end, the parent has to be convinced. That's why we are giving additional support. So in this way, if you present, it will be very easy for you to present, but you have to concentrate on the first paragraph. In that first paragraph, every points are very much important. Here, the parent is pharmacophobia, not the baby. Sometimes we will get confusion. The patient is pharmacophobia means the baby is not willing to take medication orally. So our conversation should not go in a wrong way. So always in that first paragraph, what is the content, you have to read very carefully. You will get your role, and you will get to whom you are talking, and what is the scenario, what is the location, and what is the content, what is the disease condition, and what is the purpose of this conversation. This everything you will get from that simple paragraph. Keep it in your mind every point and prepare your introduction as well as conclusion very clearly. So I hope which is clear for you. You can continue with the same scenario. If you need more role play explanations, you can go to my YouTube channel. You can see the playlist. In that, you can select the speaking. Then you can see more explanations and role play examples. So I hope it will be helpful for your exam preparation. Thank you for watching, and we will see with another one role play card or letter discussion. Until then, bye. Take care.